have a couple of things to go over related to the Opioid Response Network, who is helping host today's webinar. So the SAMHSA-funded Opioid Response Network assists states, tribes, organizations, and individuals by providing the resources and technical assistance they need locally to address the opioid crisis and stimulant use. Technical assistance is available to support the evidence-based prevention, treatment, and recovery from opioid use disorders and stimulant use disorders. The Opioid Response Network provides local experienced consultants in prevention, treatment, and recovery to communities and organizations to help address this opioid crisis and stimulant use. ORN, the Opioid Response Network, accepts requests for education and training. Each state and territory has a designated team led by a regional technical transfer specialist who is an expert in implementing evidence-based practices. Here is where you find more information on the ORN or to submit a technical assistance request. And this is just a little disclaimer on funding from SAMHSA, and that the views expressed here do not necessarily reflect the official policy of the Department of Health and Human Services. The overall approach of the ORN is to build on existing efforts, enhance, refine, and fill in gaps when needed while avoiding duplication and not recreating the wheel. The overall mission to provide training and technical assistance via local experts to enhance prevention, treatment, especially medications like buprenorphine, naltrexone, and methadone, and recovery efforts across the country addressing state and local specific needs. And there's just a little brief video here.
Communities across the nation are mobilizing to address opioid and stimulant use and the overdose crisis. You can't overcome this alone, but we can, together, and we are. We are the Opioid Response Network, a coalition of 40 national organizations representing more than 2 million people. We serve all 50 states and 9 territories locally through our network of nearly 1,000 professionals working across prevention, treatment, and recovery. For state agencies, organizations big and small, and individuals working to address local needs, we bring training and education to bear on your efforts. We're here to help you help others through evidence-based support, all at no cost to you. For instance, the Opioid Response Network helped the Tribal College in New Mexico join forces with local organizations to develop a culturally appropriate prevention, treatment, and recovery training series for its students. In Rhode Island, we convened correction staff from 34 states to share how a program had reduced post-incarceration overdose deaths by more than 60% and supported them in their efforts to build similar programs in their home states. In West Virginia, we mobilized to help a clinic incorporate substance use disorder services into their practice, serving a faith-based community. We helped healthcare providers in South Dakota address barriers they face providing treatment services for their patients. We're here to help those on the front lines. So, what are your needs and how can we help? Visit the opioidresponsenetwork.org to learn more and to submit a request for support. The Opioid Response Network, funded by the Substance Abuse and Mental Health Services Administration.
I am really excited to be talking to you all today about adolescent recovery as a social process, examining and fostering social network change. I am Associate Director and Director of Biostatistics at the Recovery Research Institute and also Associate Director of the National Center on Youth Prevention, Treatment, and Recovery, both at Massachusetts General Hospital. Today, I'm really excited to be talking to you about this topic. It is my entire work is devoted to understanding adolescent recovery. So just a quick disclaimer, I'm going to be talking about research that was supported by the NIH, but I'm not representing the official views of the NIH, and I have no other conflicts of interest disclosures to report. So just to get everybody on the same page about what I'm talking about when I talk about recovery and adolescence, just to begin and talk about, what is addiction recovery? There's lots of different definitions out there, and talking to folks that are going through recovery, they're going to have their own definition. I use this definition when I'm thinking about recovery from a research lens. So it's the SAMHSA definition where it's a process of change through which individuals improve their health and wellness live a self-directed life, and strive to reach their full potential. I think it's really helpful to use this kind of more broad, holistic definition when we're talking about young people in recovery, because oftentimes they're not really focused necessarily on changing their substance use, but they're really passionate about some of these other things, and some of these things can be motivators for making those positive changes. Well, of course, addressing the substance use is a piece of that. I really like to focus on this broader perspective. And so I have a few kind of underlying principles that guide my work when I'm examining adolescent recovery from that research lens. First and foremost, youth are not simply mini adults. I don't know if any of us on the call remember being adolescents or youth, but I think we're quite a bit different than we were at that stage. It's a very unique developmental stage. There's a lot of change and transition going on, and more importantly, young people can be active partners in treatment and recovery, and should be. And oftentimes that takes, sitting down with them and having those conversations and treating them like active partners and collaborators and experts in their own experience. And along those lines, substance use serves a purpose in their lives. If they're using substances, it's for a reason. So what you need to do is find out, what matters, why they're using substances. And a lot of that is, in conversation with them, which is what my work tries to do. And I know, a lot of the collaborators and community partners I work with that are on the ground working with young people every day, they're having those conversations, and they're telling, they're figuring out, what is substance use serving in your life, and how can we figure out how to address it from that perspective. Furthermore, context really matters. So young people are in our communities, they're in our schools, neighborhoods, they're in homes, and they're in these spaces that they may not necessarily have had a choice in deciding, right? You don't often get to choose the family that is around you, that you grew up in. You don't often get to choose the school that you're a part of, and all of that plays a role in how they initiate substance use, as well as kind of when they decide to stop using substances. So understanding that overall context is really important to understanding a recovery trajectory. And that's one of the reasons that I'm so passionate about understanding social networks and social influence in particular, to really get a sense of what that context is. So along those lines, about this being a really unique developmental stage of time in a young person's life, lots of things are going on. They're developing self-regulation skills. Their social networks are developing and changing as they begin to kind of move away from the family environment. As a result of their developmental stage, they do have a heightened vulnerability to experimenting with substances. And because of that, they also can tend to actually have a heightened vulnerability to habitually using substances. And part of this picture is that they're really relying more on their peer social networks for support and approval. And so they're looking outwards to make decisions about substances or other health behaviors. And what we know from existing research is that peer networks oftentimes at this age, during the adolescent time period, often will reward more risky decisions like substance use and other kind of risk behaviors during adolescence. But it's important to know that adolescents use substances for a variety of reasons. I probably have not captured all of them here on the slide. For some, it's experimentation or boredom. For others, it's because their friends and peers around them are using, or the family environment kind of encourages use or doesn't discourage it, or there isn't a strong structure in the house. And for other young people, they're coping with mental health symptoms or kind of some sort of traumatic experience. And so these all play a role in using substances and can play a role in developing addiction. Today, I'm really going to be focused on the social environment, so friends, peers, and family and others in their lives. But I wanted to recognize that there are kind of lots of different pieces of using substances that are important to understand for a young person in their recovery journey. And along those lines, thinking further about social influence, it's a really complicated picture. So young people can have a variety of relationships. This is just an example for friends where they may have friends that are encouraging use, or that are actively using or use on occasion. So kind of different gradations of use. Alternatively, they could have friends who are in recovery who support non-use or non-using themselves. And what we see is kind of not what the top picture represents, but really what the bottom picture represents. Is there's often kind of gradations of these within a group and across groups. And this is just one example of a type of group, a very specific kind of broad friends group. But if you think about this multiplied across peers, across family, across others that they come into contact with, it becomes really tricky to untangle the different kinds of social influences in someone's recovery journey. And there is quite a bit of literature on social influence and substance use. So there is a kind of a great evidence base for, yes, there is a ton of social influence that affects how young people use substances. And so I'm trying to build on that work and my own work and really get into some of the nuances and complexities of these relationships. But just to kind of set the stage, we know for young people that with friends and peers that are actively supporting their recovery efforts, they're more likely to be abstinent. We know that there are certain elements of families that can be supportive in terms of having a structure, engaging the family in treatment, parents that learn new parenting skills and practices through that treatment or through kind of recovery support services like alternative peer groups that Dr. Nash, who's on the call, has studied quite a bit. And we also know that recovery role models can be a really great source of recovery support for young people, and that they can model those recovery behaviors, understand addiction, and also be able to support young people in that process. So we know a lot of the positives around support, and we also know that there's a lot of barriers for young people, right? So alternatively, using among peers can be a strong predictor of returning to use after treatment. In families where there is substance use, that can present a complicated picture for a young person. If they say, well, you're acting in this way, but you want me to do this, it's kind of in conflict there. Poor relationships. And then it can be difficult for young people to initially begin to identify recovery role models. That they're not all over every community because can be hard to find individuals in recovery. I know we're in recovery month, but not every month is recovery month. And so it can be a hidden condition in some communities. And there can also be some negative stigma around recovery culture, especially as young people kind of view it. And so that's kind of big picture what research and evidence has kind of initially shown. What I wanted to talk a little bit more about before I talk about how to better examine social networks is really some of the underlying theory on social influence and change. And so essentially, the idea is our world is a social world. You and I do this every day. When we're out and about, we're kind of all the time dividing the world into categories. I mean, for example, joining this call, how many of you might have kind of peeked through the attendee list to see who else was on the Zoom, to see, or the Teams, to see who else was here, right? Who else is part of this group? And so the underlying idea is you either feel like you belong to a group, and you do that by seeing what their norms, values, and behaviors are. So if you feel like you align with those things, then you see yourself as part of that group. And if you come into contact with another person or group that does different things, then you kind of see them as an other group. And this is really important, this kind of foundational understanding, because we are all seeking a positive social identity. We all, to some extent, want others to like us, to feel belonging. And so when you're seeking that out, you're going to act in ways that the group approves. And so you're going to be doing things, in a recovery-oriented group. If you want to be part of that group, you will act in a way that that group kind of expects, right? The norms and values and behaviors that you see them, you also want to participate in. And for young people, having a positive social identity can serve their basic developmental needs. It can really help build their self-esteem, help them find meaning and purpose. And so this isn't a bad thing. This is just kind of how the world is. And it's important to understand, especially as young people are in a phase of life where oftentimes that social piece is really important to developing an understanding of who they are. And so the underlying piece about kind of this social different types of social theories is like, I am who I am based on like we are as a group who we are. And so really that strong identification with others around you. What's also interesting during this this developmental period is adolescents are kind of considered in a transitional stage of identity development. So I like to think about it like they're trying on different pairs of shoes, right? So you think about different shoes for different events, kind of different groups for different needs that you want in your life. And so they're actually quite good at coming into social spaces and trying out fitting in with different groups, and they do this because they're ultimately seeking, as they're developing into young adulthood, groups to which they feel like they belong. And so there's also, a lot of opportunities for young people to make these social network changes as they're going through a treatment and recovery experience. And this aligns with some broader theory that was developed by David Bess and also Kay and Monahan that really think about social network transition during the recovery process as a function of the kinds of services or groups that you come into contact with. And so the idea is essentially when someone is in active use, they have kind of on the left-hand side of the slide, they have multiple groups that are part of their lives, and some of those groups aren't using substances, some of them are. But the groups that are using substances are really exerting a very strong influence on behavior. But as someone engages with treatment and recovery groups, kind of in that early recovery phase, what we start to see based on this theory is this shift where now that the group who is using substances may not be exerting such a strong influence on behavior, in part because they have these new groups that are developed through their engagement in these recovery supportive groups and services and things like that. And so ultimately what they propose is based on social identity theories of kind of by the end of the process or the journey into recovery, or where someone is in stable recovery, that the groups that are not using substances and recovery-oriented groups may have a really strong influence on one's identity, so that they can still have groups in their lives that are using substances, but they're not affecting or influencing their behaviors. And of course, all of this happens within the larger kind of world of, how much recovery capital or resources do they have, and what kinds of barriers might be getting in the way of their recovery process. And so related to this is this G-chime theory, which was actually kind of pulled from the mental health recovery field, which really has been proposed as a way of thinking about kind of the underlying mechanism of what happens socially during a recovery process. And so the idea with G-chime is really thinking about, kind of on the left-hand side of the slide here, connection as being the fuel of recovery that kind of really jumpstarts that car. And then as you feel connected and belonging with others that are part of that journey with you, you begin to develop hope and meaning, and kind of longer term distal effects are, empowerment, taking control over your recovery process, and forming that new social identity that's recovery supportive. So for some folks, they may not want a recovery identity. They may think about that as in the past, so it'd be more of a non-using identity. And throughout this process, you would expect to see kind of growth as they're transitioning during their recovery process. And so we applied this model to some qualitative data that Dr. Nash shared with us, and it was qualitative data of young adults who were reflecting back on their experience in an alternative peer group or a social peer group for young people in recovery. And it was interviews with them and also leaders of those groups. And what we found in that study, analyzing those qualitative interviews, is really kind of aligned with this model that we see here in terms of connection, kind of being the driver of recovery. And so what we oftentimes saw was that connectedness was indeed the initial piece that got people very excited, and really was the bridge when they were feeling hopeless and not sure where to turn next. That connection with the other young people in the group that were also seeking recovery really helped sustain them. And then they kind of began to develop the other factors in the model. And we saw that for most young people, but importantly, what we also saw for some young people that didn't talk about connection as much, they really focused on their own internal motivation and strength. And so it was important for us, thinking through these implications. Obviously, one big piece is connection. How do you develop connection for young people, but also recognizing that that's going to change for individuals, and that for some it may be that motivation, and connecting to the group may not be part of that. So there's a QR code there to scan to have access to that paper. But what I wanted to kind of end this piece on before I talk about measurement and examining social networks and social identity is really something that makes it quite hard for young people to connect during a recovery or treatment or recovery experience, and that's stigma. And so our definition of stigma is when an individual or group is considered to basically have a devalued trait, and this can lead to a variety of negative consequences. An individual perceives stigma, so they feel judged. They're actually actively left out of things, like they're not hired for jobs or accepted to schools because they've had this experience. And they also may be less likely to seek treatment as well if they feel they're going to be stigmatized by their doctors. And furthermore, there can also be internalized stigma where you kind of take on the negative views that you think others have of you for yourself, and you start having that kind of language. And that can be a real barrier to engaging in recovery, because then you begin to feel less than or not worth the investment. And so, as we know, addiction is a highly stigmatized condition. And so it's important, in our work, when we're working with young people, to really think through and recognize that stigma exists and how we can try to combat that. And so this is one of the interviews that I had done with a young man who had been in recovery for a few years and was really, quite positive about it, but felt a lot of stigma from those around him. He wanted to share that people need to realize it's more than just someone choosing to do the drugs at first. It's like a bad nightmare that just keeps going on every day. And so for him, he felt like not having that understanding really got in the way of building connection with others. And so just important as we kind of talk through some of the next findings I'd like everybody to consider, and maybe some questions around this, how this might influence building connection and recovery supports. So the last kind of like prime section of this talk is really around measuring and examining social influence. I will be talking about several of my research studies that have done this. And so I'm not going to present all the details of each study, but they're going to be interwoven. So I'm happy to take questions afterwards about specific elements of the studies. But the combined work really focuses on this idea of social identity mapping. And what it is and kind of how you can use it for both data collection as someone who does research with young people, as well as potential intervention. And so this is a tool that was developed by researchers that were in Australia, so Dr. Cruise and Alexander and Catherine Haslam, as well as some others. And they essentially wanted to find a way to visually represent an individual's social network without having to do a bunch of onerous surveys, and kind of be able to see all these relationships together. And Dr. Bess and Dr. Beckwith came along and adapted it specifically for addiction recovery. And then when I came into this work, I had seen that this had been done. I wanted to test it out. I wanted to see, to what extent it's useful to use with young people. To what extent do the different elements that are being captured make sense, and are they predictive of a young person's experience in recovery? And so that was a lot of the work that I'm presenting today was funded through a career development award from the NIH. And so if we just look on this map, just to get everybody kind of up to speed, what we see is each Post-it note is a different group in somebody's life. The size of the Post-it note indicates the importance of the group to that person. This is all centered around the me in the middle to reflect the person who is creating the map. And then on each map, we get the number of days that they spend with that group, the level that they identify with that group. It's rated on a scale of 1 to 7, and then the number of people in that group. And so, for example, this group is a family group. They're rated as most important, and then we get the substance use. So the drug use, other than nicotine, is in the smaller yellow dot, and then the larger dot represents alcohol use, and then we get that for each person. And so they're also color-coded. And so red represents heavy use, yellow represents casual use, blue would be kind of non-use or abstinent, and then green would be if they're, a recovery person in their network. Additionally, the map captures the level of conflict between the person and their groups, and between the groups and each other, if there is any. as well as a level of commonality. So there is a lot of information in this map, so from a research perspective, it can be actually quite helpful. And so what we did in this study is really pilot this work. And so we sat down with young people ages 12 to 19 and had them do the map. We created a facilitator guide. This is an example of one of the maps from one of the young people. So you can kind of see it, not in a drawn figure, but this is actually what they look like. And you can see they were, very careful with how they drew the lines, and you can see there's some conflicts between these different groups and things like that. And so this work, we had them do the map, we created the guide as a result of that. And then we also asked them questions about their experience, both doing the map to make sure that when we asked about importance or level of identification with the group that we were measuring, what we thought we were measuring, and then to see, what they thought of it and if we should make any changes and things like that. So that's an example of one of the maps. You can also read the paper online. This is an example of another one of the maps. So it can be fun for the participant to kind of doodle and things as they're creating the map. It can make it hard from a research angle. But we can already see here just differences in how individuals think about their social networks. So, in this case, the young person on the right kind of had a map that included a big, large group of family and friends, kind of thought about them all as one group. Where we see here on the other side, we have a young person split, family, close friends, drug friends. And these were labels that they gave, their own groups. So there's just different ways that young people will participate when you're doing a social identity map. And I think it's important to highlight here kind of that diversity in response. Since that work was completed, where we really finalized this approach for young people, we started a longitudinal study, and this is examining the social networks of young people within a week or two of when they've entered inpatient treatment. And then we're collecting this data from them 3 months, 6 months, and 12 months after they've left treatment to really get a sense of what happens to a young person's social network during the transition out of treatment. And so I'm presenting some of this data here today from kind of our initial baseline data of a sample of 108 young people. And so what did we find about the alcohol and drug use, first of all, in terms of their social network supports and barriers? So we found about a third reported no heavy use groups in their networks, which is great. So it means that this set of young people didn't have anybody that was heavily using substances that were part of their networks, but also says there's quite a few more who do have heavy substance use in their networks. We also found that 24% had 2 or more heavy substance use groups, and 26% had no recovery groups in their network. So just descriptively kind of a sense of some of the breakdown of that. And when you think about this in relation to their own use, we found that youth with more recovery groups had 3 fewer days of alcohol use prior to treatment than those with no recovery group, so suggesting that those recovery groups could have kind of a buffering effect. Similarly, youth with heavy substance using groups had 11 more days of marijuana use and 7 more days of other drug use than youth without any heavy substance use groups. And that youth with no heavy use groups had at least one recovery group had higher recovery capital or more resources for recovery compared to youth with different social network compositions. So just a few kind of descriptive statistics to kind of, it's in line with what we've seen with other research, but I think it's helpful to understand for a specific group of young people who have entered treatment, that kind of the diversity in substance use among their own groups and how it relates to some of their own outcomes. What we also found was quite a bit of conflict for the young people in this study across their networks. And there was a diversity of conflict. So on average, there was at least 1 high conflict line in someone's entire network, 2 moderate conflict, and 2 to 3 kind of low conflict networks, groups and networks, with females reporting slightly more high conflict groups. So females kind of had a tendency to have more conflict in their groups. And this is important because conflict can be very stressful. It can reduce one's quality of life and feelings of kind of being sad or depressed or anger. And what we also found is that having more high conflict groups was associated with having lower recovery capital or resources for recovery. And the converse was true as well. And so it's just important. I think a lot of times when we talk about youth and recovery and what that should look like and reducing substance use, you forget about some of these other things that also kind of get in the way of that process. And so conflict is something that came out as important. And then as part of this study, we also had some qualitative responses to groups and how they supported the recovery. And what I wanted to really highlight was the belonging connection that some of the groups were for the young people as part of their social world. And so one young person said they let me talk to them about recovery and actually helped me to set boundaries about what I'm comfortable with being around, never complaining or seeming upset if they can't use around me. Another young person said, my college friends encouraged me to be the best version of myself and work hard. And they really make me excited about next year. And then, this last young person said, I usually go to the addicts or my sober friends because I can tell them anything in the whole world and they won't say a single thing and be like, get out of here. And so here we really see just kind of diversity of, when we talk about recovery support and social support, like what do young people actually mean when they're saying that? Like, what do they mean by this group is supportive or that group is supportive? And here are just a few examples of how they view that support and belonging from groups that they say are supportive of their recovery. And so lastly, I had a subset from one of my previous, the pilot study of 28 young people where we looked at social identity and stigma specifically. And this was led by a former student of mine, Sophia Blythe. And in that work, we analyzed qualitative interviews and really came up with kind of three primary themes, or like categories of how the responses kind of laid out. So the first was really this idea of disclosure. So, unlike adults, I think there's a lot more variability for adolescents about when their condition is disclosed to others. And so for a subset of young people, the adolescent could choose who to tell and kind of talked about that. Or they could choose who not to tell, or they could say, my close friends I'm going to tell, but I'm not going to tell my work group. They don't need to know about that. But oftentimes they experience some sort of unintentional disclosure with a parent telling friends because they were gone for a while, or someone at school or a teacher kind of telling other students. And so there's a diversity of disclosure experiences that young people talked about, all of which affected their reentry back into, for example, the school setting. And it could make it challenging. And so when they talked about who they would tell, they oftentimes said, I would want to tell my close friends or my recovery groups because we're already talking about that. Some of them had extended family they wanted to tell, but oftentimes did not want to share that with them. Immediate family, they said, they just knew because they were the ones who brought me to treatment. But, there would be people that I wouldn't want to tell necessarily. And then they also talked about not telling coworkers, as I mentioned, but thinking forward for some young people who are heading off to college, really not wanting to share that with others and kind of saying, that's part of where I am now or where I was, but now I'm in a new space and I don't think these new people need to know this about me. And so there was kind of this difference around who to tell and when they would want to tell it. And then, after disclosure, some young people had kind of this mixed feeling of, I felt really supported by my family or by my friends, but I don't want to feel like they're watching my every move. I don't want to hang out and have them, maybe I'm having a bad day and they think I'm going to start using again. And it's like very stressful for me to kind of manage their expectations. And so they described this mixture of like both helpful and unhelpful interactions, as well as some experiencing really stigmatizing interactions and feeling very stigmatized in certain settings. And that was primarily when there had been unintended disclosure, and they came into that setting and everybody had found out, and so they felt stigmatized there. But there also many of them that had experienced some level of stigma really discussed and demonstrated resilience and really how they navigated that situation and turned it into something that wasn't kind of traumatic for them reentering that setting. And so, throughout this, we were asking them kind of different questions about their experience. And then we also asked, what are some ways you prefer to talk about your experience, and what are some ways you don't want to talk about it? And it was a really mixed bag. So some people said, no, I don't have any preferred terminology. Some people really preferred recovery-oriented language. Some people didn't like using the terms addict or alcoholic, or only were okay with that when they were the ones using the terms about themselves. And so what we, concluded from this work is essentially, if you're going to talk to a young person about their experience in recovery, ask them how they want to talk about it. Use the terms, find out from them how they want to discuss it, and use those terms to talk about it with them. And there could be more work done in this space to kind of educate families and schools and others who interact with young people so that they're also doing that same thing and kind of coming up with ways to support young people using the terms that they like. There's not one rule here. And the other thing that we suggested as part of this work is really, there are some opportunities to develop some ways to talk about and for young people to be able to disclose in a way that feels good to them, and also to kind of manage what happens after that disclosure in a way that's feels good for them as well. And so one of the other things that I mentioned kind of briefly is that we're looking at this over time, right? How do networks change over time? And so I wanted to just give an example of, descriptively what that might look like. And so this is actually an example of a map of someone that has started treatment, and then their map 3 months after treatment. And so lots of color going on here. But what we can see, starting out is that, they have a family and therapists that are part of their network. They also have this partner, friends, work, and job, and those are all kind of heavily using groups. There's also quite a bit of conflict that's happening because there's the different colored lines. I don't know how it's coming out on your screen, but there's quite a bit of red colored lines and some orange, which indicates a high degree of conflict. They also have kind of this activism and this other kind of smaller group. And so what we see, 3 months after treatment is a lot of change, right? So some of the groups from the initial map are totally missing. There's a lot more recovery groups that are part of this person's network after they've left treatment. So 3 months after treatment, which is really positive. And we see some conflict, although it's been reduced. And so just kind of for you all to get a sense of the potential change, this is one map. So you have to kind of think about it as one example. But if we look at a subset of 60 participants over time, we can kind of see how this begins to tell a larger story. And so this was work that was done by my former research coordinator, Shane George. He presented a poster on this work. But I just wanted to highlight, because I think it's helpful to see really the complexity of social network change. And so overall, in this sample of young people, they had an average about like 4 to 6 groups essentially. And so what we see for their friend group is at baseline, they have a mix of different types of use of groups, with the heavily using friend groups being, having the most of those, followed by casual, and then some non-substance using groups and some recovery groups. And then 3 months later, what we see is a huge drop in having those heavily using substance groups part of their network, and increase in casual use, but then also some increase in a recovery group in their network. And when we move to looking at treatment peers and recovery support service peers, we see, obviously during treatment, there's going to be more treatment groups because they're more actively connected to those groups, especially inpatient treatment. So we see kind of this natural dip at 3 months post-treatment, which would make a lot of sense. But now what we see for recovery support service peers is an increase 3 months after that treatment episode. So just interesting to see, overall, and these are just 3 groups categorized in their networks, kind of what happens over this time period. And, like I mentioned earlier, kind of trying on shoes, trying on different groups, especially as they're moving in and out of these spaces. And so let's see here. I will try to speed through a little bit. So one of the things that we also wanted to understand how a group supports the recovery. So they were prompted to write that a response to that question for each of the groups on their networks. And so we've already seen the supportive relationships one. But some people unprompted, indicated that a particular group was not supported. So they want me to continue to use as they see me as more fun when I use. Another young person kind of said something similar. They often try to get me to use. And then, there were a variety of young people that responded that they kind of had these mixed supportive relationships. So this first young person says, people I can trust and I love, but I know for the better I can't be around them or I will use again. And they say they've made many friends by using substances, which is often the case. And they say it's hard to let go of the drug, but also the friend. So they're kind of recognizing that they might need to reduce some of those connections, but that's really hard to do. And another young person was saying, they respect my boundaries, but they talk about using frequently. And so we can see kind of the diversity of the ways in which groups can be supportive or unsupportive or kind of a mix of both. And so one thing I did want to say, just in our pilot work, what really jumped out to me when I was working with these young people is the importance of being able to actually physically see your network, different from how researchers typically capture network data, which is oftentimes a survey and you're asking about different types of groups and things like this. But this really allowed them to kind of put all their groups on a visual and then kind of reflect on it. And so for one young person, and several others actually, but this is a quote from one young person where they said, I feel like I knew it, but seeing it, there's such easy access to me continuing to use, because they could see all over their network the color of kind of casual or heavy substance use. For other young people, they really appreciated that they could see their progress. They could see the hard work that they'd made in their recovery kind of pay off. And so this young person said, I may have some bad apples, but the good support that I have completely outweighs the bad support. And in the longitudinal work that we're doing now with patients in treatment and when they've left treatment, we actually have had them request to see their social network maps over time. So they always have access to them at each study visit, but we've been able to kind of generate a one-page flyer that they can have, so they can actually see that change over time in kind of one place. Which was a request that they had. So clearly there's some interest here from young people as well. It seems like to better understand their social relationships. So in summary, what we found is, youth in recovery are still reporting many relationships with individuals who are using substances in their social groups. And these groups serve a variety of purposes for them. So it's not just around the substance use, it's oftentimes around other things that they feel drawn to and connected with. Youth in recovery also have relationships with individuals who are not using substances or in recovery. And again, those relationships serve a variety of purposes. What we also see is conflict is kind of present throughout the relationships. And it really varies the sources and types of conflict. So for folks who are interested in understanding conflict and recovery, I think that's an area for further research. And for me, what I found, what I've shared kind of in previous talks as well around social identity mapping, it's a really useful tool to kind of understand social network change among youth. And the youth that I worked with really talked about it being fun. Somebody actually used that word, or not as boring as they thought it would be. Both of which are pretty good when you're doing research with folks. And furthermore, based on some of the qualitative work that I've done, we're kind of thinking about this as a useful tool for intervening in the recovery process, as it kind of generates potentially the development of self-insight. And so I will have a grant starting that will actually be doing this to kind of adapt the tool for intervention with young people. So stay tuned if you're interested in that. And I think that is all of my prepared remarks. I do have email if folks want to reach out afterwards or get access to any of the papers. I'm happy to share those. Some of the social media stuff and our websites, happy to share those. And I think the last thing is the survey link in terms of the slides, but I'm also happy to take questions for a few minutes. So if that's available, and
Yeah.
you want some, yeah.
Great. Can everybody hear me? Okay.
Yep. Yeah.
Awesome. So I will help moderate the Q&A. Yes, please. Um, I'm glad you have that slide up so I don't forget. Um, please use this QR code to provide feedback on the presentation and the webinar at your own convenience. So there are a couple of questions in the chat, Dr. Hennessy.
Okay.
First, there are a few specific questions about the social identity mapping. Somebody wanted to know first how heavy use was defined, and secondarily, somebody wanted to know how conflict was defined. So just a couple of specific questions about the social identity maps and how you define certain terms.
Yes. Yeah. Great questions. I'll start with conflicts because we ended up in the pilot, we did some work around, when we say, indicate high or low conflict, what kinds of things are you thinking about? And so we used responses to that to kind of shape how we would instruct folks for the larger studies. And so essentially, low conflict is kind of that everyday, bickering kind of back and forth, like little things that you wouldn't necessarily lead to a major blowout or a fight, whereas high conflict would be more that major blowouts or fights or really kind of like bashing heads with folks. So again, it's a little bit subjective, but we found for most young people, they could think about those categories pretty easily. And it was similar for heavy substance use. And we really said, think about the use of your group. And if people are using like all the time when you get together and using a lot when you get together, that would be more that heavy use. Whereas casual would be maybe more kind of, you know, at a party, but not, everybody getting wasted, kind of something lesser than that. So we tried to keep it vague enough that it's not a timeline follow back. In a few, it's more of like people's sense of when you hear those words, and we did get consensus in the pilot work that people were responding that made sense with those kind of levels, if you will. So yeah.
Great.
Okay.
And then
Was there another clarification or?
And then somebody just popped in the chat. This is about social identity mapping as well, whether the mapping differentiated between in-person and virtual or online interactions.
No. So we started this work during the pandemic. And so what we asked young people to do is think about it, whether you're texting with this person all day or, that kind of counts as it can be a group in your social network, and you can also indicate the number of days kind of based on that. We did have some young people have like a social media group on their map or like social media acquaintances, and so they would label it as that. But it was really, we didn't try to have them we didn't instruct them to create different bubbles by whether or not they saw them in person or saw them virtually, because young people are often kind of doing things on their phones. So we kept it simple in that sense.
Great. And there are just some general questions, although I think some folks were answering them in the chat. There were like questions, and then some of the people were answering them. But just any recovery groups, some people were asking about them in certain areas, like Massachusetts, for example, although we've got a national audience here. So we've got a couple more questions. Let's see.
Yeah,
So
maybe I'll take down this so I can't see the chat with my screen.
I've got it. Yeah, so I think all those questions were answered basically around specific groups, but then there's a question about also social identity mapping. Says SIM sounds like a very promising clinical tool. Are you recommending that researchers incorporate this technique as a method of measurement? How might that work? For example, is there a scoring system?
Yeah, so yes, so I am recommending that we use it as a form of measurement. I think because it makes it a lot more fun for participants, and you can get really rich data. in terms of managing the data that comes out of it, that is where it begins to get a little bit more complicated. When we were doing the by hand version of the mapping, we created a REDCap database that would essentially quantify everything on the map. And I'm happy to share that with folks if they want to take a look at what that looked like. And then from those quantifications, we could create things like ratios of time spent with certain kinds of groups, and lots of different variables, kind of any type of variable you could imagine in combination with those factors. And so that there is no recommended guide on the top 10 variables that you have to include in your analysis of these maps, because it's still kind of developing out what that should look like. And some of the work that I'm doing will hopefully contribute to that. There is an online version also where they have a data, it's kind of automatically quantified, and lots of variables are automatically generated in that sense. There's a license fee with that. It's through the University of Queensland in Australia. There's kind of pros and cons to the different approaches, but I think for data collection, it's super helpful and engaging for young people. So I definitely recommend it.
And I think finally, before we end, there's a few different questions around this, but do you have any recommendations for clinicians based on what you know today and your findings and your overall, all the work you've done on how they could use social identity mapping in their clinical practices, like based on what you know now?
Yeah, and I think, and I actually see a comment here in the chat as well, that there's some version of this that's been used kind of in clinics with emerging adults, it sounds like. And my next grant will actually kind of develop this out into more of a standardized practice, because anybody could essentially pick up the tool, pick up the facilitator guide we created, and have a young person do it. But then it's like, well, so what do you do with that information, and how do you start a conversation with them? And we piloted some initial questions with young people around kind of that self-reflection piece, but my next work will really kind of take that to the next step to make it more of a standardized approach.
Great. And we do have 2 minutes until the end. I have a question, and it's probably, the answer probably would go way past 2 minutes if we were really doing it justice. But what lessons do you feel like you've learned, big picture, around differences between adolescents and adults, from what we know about adults, in terms of social network change, just any kind of like overall take-home messages for the audience about what specifically we should be thinking about when it comes to adolescents that might be unique when it comes to young people?
Yeah, it's a great question, and I have kind of lots of thoughts. I think I think when I started out this work, I would oftentimes just hear about the importance of changing social networks for young people, right? And just get them away from their substance using friends and problem solve. But the picture is like, quite a bit more complex. And really that initial piece about kind of understanding, what purpose does the substance use serve, and how, like, is that how they made these initial connections? And really being more thoughtful about treating adolescents as owners of their own experience and using that in practice. Whereas, adults like to think we know everything, but that's not really true. So.
Thanks. So with that, we'll end. Thank you to Dr. Hennessy for a wonderful presentation. And you all will be getting emails with the slides, a link to the video and to the QR code. And I know Dr. Hennessy is more than happy to hear from you via email if you have additional questions. Thank you, everybody, for your time, and we'll see you at the next webinar on December the 10th.